Welcome to our explainer on clinical reasoning. This is all about giving you the tools you need, the critical thinking skills, for your entire journey as a dental professional.
All right, let's quickly run through what we're going to cover. We'll kick things off with a classic diagnostic puzzle. Then we'll dive into how your brain actually works to solve it. From there, we'll map out your journey from student to expert, give you a guide to follow, and, super important, talk about the common thinking traps and how to stay out of them.
You know, every single dentist, no matter how long they've been practicing, has these moments of uncertainty. So let's start with one of those classic scenarios that you are absolutely going to see in the clinic.
Okay, so picture this. A patient is in your chair. They've got a deep periodontal pocket, and there's a draining sinus tract. So where's the problem coming from? Is it endo, starting from inside the tooth, or is it perio, starting from the gums? The signs and symptoms can look pretty much identical, which puts you squarely in a diagnostic gray area.
And here is exactly why this is so tricky. The inside of the tooth, the pulp, and everything surrounding it are all interconnected. They have these tiny little channels linking them. This means that a disease can easily spread from one to the other. A pulp problem can totally mimic a gum problem and the other way around. And that's the connection that makes this so tough.
So, how in the world do you solve these kinds of puzzles? Well, it all comes down to understanding the two very different ways your brain goes about making a decision.
Think of it like you have two different systems running in your head. System one is your autopilot. It's that fast, intuitive gut feeling. It's what happens when you look at an X-ray and instantly recognize a pattern you've seen 100 times. Then you have system two. That's your analyst. It's the slow, methodical, and effortful thinking you have to switch on for those really complex cases where you need to weigh every single piece of evidence.
And get this? Expert clinicians, they actually use that fast, intuitive system one for up to 95% of their cases. Now that gut feeling isn't a random guess. It's a highly developed skill built from seeing thousands and thousands of patients. They save that heavy-duty system two thinking for the truly weird and complicated cases that don't fit a familiar pattern.
Okay, so how do you get to that expert level where your gut is right 95% of the time? Let's break down that journey, charting how your thinking evolves over your career.
We know there's a pretty clear path. You start as an advanced beginner, right? You're sticking to the rules and procedures you learned. Then you become competent. You start analyzing things, asking questions. Next, you're proficient, which means you can adapt your plan as things change. And then finally, you reach expert. That's when you have this deep grasp of the whole situation and you just get it almost instantly.
I love this quote because it just perfectly captures the big shift. You move from a task-oriented mindset, a checklist of things to do, to seeing patient-specific patterns. You start seeing chunks of information that all go together. That right there is the hallmark of true expertise, seeing the individual patient, not just a list of procedures.
So to help you navigate this journey, let's look at a really practical framework you can use. Think of this as your personal map for clinical thinking.
This is the clinical reasoning cycle, and the key word here is cycle. It's not a straight line, it's a continuous loop. You're always moving through these phases, from collecting information all the way to reflecting on what happened, and that reflection feeds right back into the next patient you see.
Every single one of these steps is critical. You collect every clue you can. You process what it all means, separating what's important from what's not. You nail down the actual problem. Then you set a goal, you act on it, and then, and this is the most important part, you evaluate and reflect. Seriously, that last step is the secret sauce. Reflection is what turns your daily experience into true expertise.
Okay, so now you have the map, but a good map also shows you where the traps are. We need to talk about the cognitive biases, the mental shortcuts that can lead even the very best clinicians down the wrong path.
And this image really says it all, doesn't it? Our brains are wired to be efficient, so they love taking shortcuts. But the problem is, sometimes those unconscious shortcuts can seriously warp our judgment, and we don't even realize it's happening.
First up, confirmation bias. This is a big one. It's when you get an idea in your head, and then you unconsciously look for evidence that proves you're right while ignoring anything that suggests you might be wrong. It's like deciding it's a simple cavity, and only focusing on the one view that confirms it, completely missing a subtle clue on another film that points to a bigger problem.
Then you've got diagnostic momentum. This is when a diagnosis gets attached to a patient, and it just kind of sticks. The referral note says cracked tooth, and suddenly it's really hard for anyone to see past that label. The diagnosis gathers so much momentum that other possibilities get pushed aside, even when new evidence shows up. And then there's the representativeness heuristic. This happens when a patient's story fits the perfect textbook picture of a really rare disease. You get so focused on how well the signs fit the prototype that you forget that common things are, well, common. It's much more likely to be a common problem presenting in an unusual way.
But it's not just about the biases inside your head. We have to remember how physically demanding dentistry is. And as this quote points out, when your body is tired, your mind gets tired. And when your mind is tired, your hands aren't as precise. It's a feedback loop that makes our profession pretty unique.
So here's the bottom line on that. A little bit of stress, it can actually sharpen your focus. But too much stress, day in and day out, just overloads your cognitive circuits. Your ability to process information tanks. And when that happens, you are way more likely to fall into one of these thinking traps.
This all leads us to the final and, honestly, the most important tool in your entire clinical toolkit, and that is the skill of being able to step back and examine your own thought process.
It's called metacognition, literally thinking about your thinking. It's developing that little voice in your head that pauses and asks, hang on, why do I think this? Am I jumping to a conclusion here? Am I just seeing what I want to see? This skill allows you to catch your own biases, to recognize when you're stressed, and to consciously switch from your fast gut-feeling brain to your slow, analytical brain right when you need it most.
By actively practicing metacognition, you turn every single clinical challenge into an incredible learning experience. This is how you build true expertise. So as you go forward, I want you to leave with this question. What is the one thinking trap you're going to consciously watch out for next time you're in the clinic?